We have two problems when it comes to the mental health and illness. We have too much mental illness, but we sure do not have enough mental health. And they are both big problems. And when it comes to prevalence, in terms of the total amount of the world's population, the bigger problem is the absence of good mental health. And if we don't deal with that, guess what? 2030 will come along. The World Health Organization, WHO, will pat itself on the back, and I will be depressed as hell because a prediction that didn't need to come true came true because we didn't do anything different.
This is the Public Health Insight Podcast. Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
In the previous episode, Linda, Gordon, and LaShawn spoke with Dr. Corey Keyes, a distinguished full professor of sociology at Emory University, about positive psychology, the burden of mental illness, and some important distinctions between mental health and mental illness. In the second and final part of the discussion, Dr. Keyes remains to explain the Two-Continua model of mental health and illness, the concepts of flourishing and languishing, and the urgent need to promote positive mental health. This is where they left off.
Dr. Keyes, it sounds like this lack of understanding has created a disconnect in a way, in terms of mental illness, the idea that treating mental illness solves a problem, right? So this lack of understanding of the Two-Continua model influences how, put the dollars and where policymakers decide to implement policies. So then instead of seeking ways to enhance positive mental health, we're only looking for ways to alleviate the negative, and by doing that, we miss a lot. So can you tell us about how this approach has led us to not making a collective impact, or are we making an impact?
Well, Gordon, your point is the million-dollar question, and this is the question of you need a diagnosis and a code when it comes to something having to do with mental health and illness in order to get insurers to reimburse healthcare providers. And it wouldn't be a stretch at this point to be able to expand what could be diagnosable. And this is one reason I have been very medical and psychiatric in the way I've approached diagnosing. I use the word diagnosis of positive mental health. And I got a lot of flack from positive psychology. But I was being very, very deliberate. As I like to say, psychiatry had already built a garage, a nice big garage with a lot of nice tools in it. And I was going to back my truck right back into the same garage psychiatry built so they couldn't kick us out. And so we approach diagnosing mental health, positive mental health, in the same way that they go about asking questions and diagnosing depression. So it's just a matter of time in getting legislative support and individuals who have familial experiences or experiences themselves with losing people due not to mental illness, but to languishing or the absence of good mental health, to championing a payment system that expands the scope of what is, when is the time to act? And for me, this is why I take a public health. Even if people are flourishing, you want to be giving them attention and help maintaining that, because data show the first loss of it, 3-4-fold increase in risks for suicide and depression. So that's the magic bullet right there. If we can somehow get a healthcare system and an insurance system that reimburses evidence-based, we need a lot more evidence-based, but evidence-based approaches to promoting positive mental health, I think we could begin to make some progress in reducing the overall prevalence of mental illnesses in the world, as well as the burden of it.
That's a great description. And we did touch on the Two-Continua model for mental health and mental illness throughout the conversation so far, but I wanted to hone in on it a little bit more. So for those who might not have heard about the mental health continuum or Two-Continua model, can you just set that up for us a little bit about, what does Two-Continua even mean? Talk us through, the different quadrants in there. Just let us know how, just to paint a visual for what that looks like for us.
Sure. Imagine it's a very simple 2x2 table graphic. So there's one line going, as I call it, from north to south. And that's the mental health continuum, the positive mental health. And at the very north of that dimension is flourishing. And as you go down that continuum, you move from flourishing to moderate to all the way down to the bottom, where you have literally the absence of the positive stuff, which I call languishing. So that's the first continuum in the first dimension. Then there's a dimension going from west to east, cutting through across from the north to south dimension. And at the very west is a diagnosable clinical disorder. You fully meet the criteria. And on the very far east is that you don't have any of the symptoms of what would constitute a clinical diagnosis in the DSM. And the way to look at it now, from traveling from east to west, as soon as you pass that north-south dimension, and you fall over on the left side, you have some clinical mental disorder. But now imagine you have a clinical disorder, but you go from south all the way up to north. If you're all the way at the bottom south and you fall on the far left side, you are languishing with a mental disorder, which is not good, because one of the important implications of the Two-Continua model is that your level of good mental health will determine how well you are able to function with a mental disorder. So if you start to move up into the middle, where you have moderate mental health with the mental disorder, you will do far better with that mental disorder. And we have plenty of data to back this up than if you are languishing. And believe it or not, there are some people who have a mental disorder who also meet the criteria for flourishing, and they function far better than the people with moderate or languishing mental health. Now, if you were to look at the prevalence of people who are flourishing with a mental disorder, it's low. It's between 2 to maybe 4% of any roughly a population. And the biggest category of people who fall on the left side with a mental disorder have a mental disorder, but they're in the middle. They have moderate. And that's roughly between 8 to 10% of any population with a mental disorder. And then thankfully it's rare, but it's still 2 to 3% will be complete languishing with a mental disorder. And so the vast majority of studies show that in any given population, the most common combination is you have a mental disorder like depression, but you have at least moderate mental health. And that's far better than if you're languishing. But it's, of course, far better if you're flourishing with a mental disorder. But then let's just assume you fall over on the right-hand side of these two dimensions. That means you're free of a mental disorder. The implication is that most people who are free of a mental disorder will not meet the criteria for flourishing. So most people in most populations are free of a mental disorder, and everyone's walking around, at least in the traditional healthcare system and biomedical model, saying, wow, isn't that great? Look at how many people are mentally healthy. And I look at my data and say, well, no, they're not. Yes, they're free of a mental disorder, but they're not flourishing. So roughly, there's huge variation by country. So like imagine in the US, a college student population, about just under 50% are free of a mental disorder and are flourishing. 35% are free of a mental disorder, but they're not flourishing. And then the rest of them are in some level of positive mental health, but they meet the criteria for mental disorder. Now, if you look at the US adult population, the biggest category of people are free of mental disorder, but they're not flourishing. The vast majority of the US adult population is free of a mental disorder, right? In any given year, if you look at, for instance, epidemiological studies, and this is generous, I'm really rounding up, no more than 25% of the adult population will meet the criteria for any mental disorder. And they assume the other 75% are mentally healthy. No.
Right.
About 40, sometimes 50% are not flourishing. Why does that matter? Because if you're flourishing and free of a mental disorder, you have the lowest risk of falling on the left-hand side. But if you're not flourishing and not mentally ill, your risk of ending up on the wrong side of that Two-Continua model, on the left-hand side, is dramatically high.
Mm-hmm. So flourishing is a protecting factor to experiencing a mental illness.
Yes, and a huge risk that is going unobserved by public health systems. They're doing nothing about it. Is in many cases the largest group of people in their country. They're free of a mental disorder, they're not flourishing, and they get no attention. And then we wonder why we never reduce the prevalence of mental illnesses in our population, because we're not acting soon enough.
Our model doesn't catch these people because we only diagnose for illness. So we can't prevent because we don't know how to diagnose for flourishing.
We do, yeah, we do. Well, we do, Linda, but I must say, having been doing this since 1995, I think we're now at a point where the genie is starting to come out of the bottle and you can't put it back in.
Okay.
Yeah, it's starting.
This is exciting then.
What the worst case scenario will be that we'll get into a zero-sum struggle with the medical establishment, especially the mental illness establishment, which will assume that if we put dollars into promotion, we don't care about people with mental illness, because everyone with mental illness, and I'm one of them, could argue, well, you don't fund our programs enough. And that's an argument that will be a losing battle.
Right. It also assumes that you cannot enhance or bring someone who has experiencing a mental illness to flourishing, and that the only way to treat those is through medication and that kind of treatment.
Yes, and there's even good evidence. I would encourage listeners. There's a book entitled "The Anatomy of an Epidemic," and the author's name is Whitaker, and he reviews evidence. Very strong body of evidence showing that for the vast majority of people with things like schizophrenia, anxiety disorder, and depression, they would have been better off because the people who were never put on medications in any of those three categories of mental disorders have better long-term outcomes than those who were put on medications initially. Wow. Now, it takes 2 to 5 years, but once there is such a thing, I'm going to use the word natural advisedly, but there is a natural form of recovery that with the help of your community, your workplace, your family, that with time, we recover and we stay recovered and far more productive than if we are put on medication. And in fact, Whitaker starts his book by showing the irony of, since 1987, which is considered the dawn of modern biological psychiatry, because that's when Prozac went on the market, that Social Security disability income claims have been increasing for people who have mental illnesses like depression and are under treatment. Increasing, not decreasing. people on modern medications for mental disorders, their disability isn't going down, it's going up. Mm-hmm. Now, that I know some of our listeners are going to go, oh my God, I'm on medication. What am I doing? Because when I teach this to my students at Emory, boom, and I tell them, well, I'm on that too. But be patient. This is the story. The sordid story of medications for mental illness is not one medication was ever created with an understanding of the underlying pathophysiological cause. Every medication was created by observing side effects of medications and procedures that were designed for something other than mental illness. If you read Whitaker's book, you will read that to be a patient with mental illness and to think that this is how they've approached the best available treatments for people like me and my students. And
by accident.
Yes, by sheer accident. And where did we come up with the chemical imbalance theory? Oh, psychopharmacology, trying to understand how these medications work. There's no evidence whatsoever for the chemical imbalance theory.
Wow.
None whatsoever. Now, why do we still believe it? Because when you put people on these medications, what does it do? It changes levels of dopamine, serotonin, and so they assumed, well, that must be people must have an imbalance. Well, no, the medication creates changes and creates imbalances. What a backwards way to treat something as serious as mental illness. That's so backwards. And so if people want to argue that we don't have a better approach, I say we've got a way better approach than reasoning backwards to causation and giving thousands and millions of people medications based on a theory that doesn't hold water. Right now, we could be out there promoting and protecting flourishing right now in our kids, in our communities. Show me where the political will is and the courage, and we'll get it done, because that's what families want, that's what educators want, that's what I want. Who doesn't want that life? So show me the courage of political leadership, and we'll get this done.
Right. And I mean, I'm so intrigued by flourishing specifically because I bet all of the people listening to this, that's where they want to be. They want to be flourishing. And you mentioned kind of the three kind of criteria that go into it. So the emotional well-being, the psychological well-being, and the social well-being components. Now, over the course of someone's life, does the amount of flourishing someone have change? And is there kind of an innate component to this flourishing?
Yes, it is actually changeable, and that's a good thing, Sean. There is more and more evidence that interventions that are aimed at moving the needle around positive mental health symptoms, it is possible. And so it's not a static state. The good news is you can move it around. The bad news is if you're not careful, you will lose it. But then here is the thing. The loss of flourishing should be a realistic thing when things change in your life, right? Right. It's a sign to you and your loved ones that something has gone wrong. It's time to reflect on it. We need each other. Let's help each other. Right. And so I don't think we should worry so much about it, that we will lose it, because if we are sensitive to it enough and treat it with the respect it deserves, we will respond to that loss. Now, here's the interesting thing. Now, turn that on its head. I've been teaching this for so long now, and when it comes to mental illness, there are all kinds of people who meet the criteria for depression. And surveys and psychiatrists are supposed to distinguish between whether that's an expected reaction or an unexpected reaction. Those symptoms are expected or unexpected. You would expect people to feel and meet the criteria for depression when they've had to go through a pandemic for a year and a half, when the whole world around them, or when they see racial injustice and killing, right? That should not be called a mental disorder when an external cause has changed the way you think and you feel and you function. Psychiatrists are only supposed to call something a clinical disorder is when your feelings, your behavior, and your thinking have changed towards the depression end, but nothing has significantly changed in your life. Hence, it's an internal something that's causing this. We're not doing that right now. And we need to pay more attention to when people meet the criteria for not flourishing or for a mental disorder, and it's expected, we need to help them address the social conditions that are causing that, not giving them pills that change and alter their neurochemistry and their brain structure. We should be changing
like their brain is doing what it should do.
Yeah, it is. It's telling them something is deeply wrong in this life, and life isn't fair, it's unjust, it's traumatic, you lose people you love, right? But instead, we're medicating a whole class of people as if they have a mental disorder when they're responding normally.
Wow. That's going to give me a lot to think about moving forward. And in general, we are quite familiar with these risk factors for mental illness. And, there's the whole diagnostic criteria to diagnose mental illness. And we know that there's a genetic component. But when we talk about flourishing, I wonder if there's that similar genetic component. Can we inherit mental well-being?
Yes. And Linda and Sean, yes, you asked that too. And we have some very strong evidence that we've published using a large study of adult twins in the United States. But this is being replicated around the world. Flourishing, it turns out, is just as heritable as something like depression and anxiety. Just as heritable. And yet, less than 50% of the genetic variance associated with flourishing is shared in common with depression and anxiety and panic disorders. In our study, those were the three that we were looking at the population level. What does that mean? It means that the Two-Continua model is part of our genetic makeup. You can inherit a high genetic risk for depression. It doesn't mean you've also didn't inherit a high genetic disposition towards flourishing. So that's interesting. The presence of genetic risk doesn't preclude the presence of genetic potential to flourish. But by the same token, just because you didn't inherit you put it this way, you inherited a very low risk for mental disorders. It doesn't mean you've also inherited a high genetic potential to flourish. So the absence of genetic risk does not mean the presence of genetic potential. Here is where the new science that's about genes, as they have any role when it comes to health conditions, at least when it comes to mental illness, there is very little, I'll say no evidence for genetic determinism. Genes alone do not determine outcomes or phenotypes. It requires environment, and that's where the epigenome is such a fascinating area. And because a lot of the genetic potential for flourishing operates independent of genetic risk, my dream, and I hope I live long enough to see this, is that we have scholars come out who devote their research to studying the environmental conditions that turn on whatever genetic potential we've inherited for flourishing. Rather than just focusing on trying to avoid environments that activate genetic risk.
Right.
So,
How do we build environments that allow us to flourish?
yes. And isn't it interesting? The positive stuff, the genes, a lot of genes for flourishing operate totally on their own, separate from risk. And we're just built that way. We can feel good and bad at the same time. You can feel happy sadness or sad happy.
Right.
Right? It's the same thing. When I'm teaching my courses and I have seniors who are in spring semester, the closer we get to the end of our semester, they start feeling happy and sad at the same time. And so we're just built this way. Just because there's no sadness doesn't mean you're feeling happy. And just because you feel sad doesn't mean you aren't also feeling happy. And that's just the brilliance of the Two-Continua model. It's
Right.
what we're made up of.
Gordon, I'm going to do my PhD now.
You've decided. No, it's pretty cool. And you mentioned, like, even at the genetic level, there's evidence to suggest that it's literally a Two-Continua model, such that, this exists over here, this exists over here. There can be interactions, but like the absence of genetic material that predispose you to mental illness doesn't preclude you from flourishing or not flourishing. It's a totally different mechanism going on, even though there is interaction.
Yeah. I can't wait for the day where we think of, just imagine all that potential lurking inside of all of our children. And we're so worried about whack-a-moling all the problems down that we're not spending much time enriching their lives, even these kids at risk. We could be doing things that unleash this genetic potential to flourishing that gives them protective features against some of these adversities that they're going to experience in abundance, but all of us, regardless, will experience.
Let's get away from the deficit models.
Yes, we are more than the things that are wrong with us.
Yes. And there's more wrong with this than the things we are willing to acknowledge, which is the absence.
Oof.
Right?
Here we go.
There we go. Yeah. Well, here's the thing. Just to make the point, we have two problems when it comes to the mental health and illness. We have too much mental illness, but we sure do not have enough mental health. And they are both big problems. And when it comes to prevalence, in terms of the total amount of the world's population, the bigger problem is the absence of good mental health. And if we don't deal with that, guess what? 2030 will come along, the World Health Organization, WHO, will pat itself on the back, and I will be depressed as hell because a prediction that didn't need to come true came true because we didn't do anything different.
Yeah. So moving forward in our discussion today, I would like us to take the next few minutes for us to explore how can we move forward? How do we build a flourishing society? And Dr. Keys, from our discussion today, you mentioned here and there different areas that we need to improve. And it kind of sounds to me like these are on different levels of, like, as individuals, as a community, and then at the level of our health systems. And so in your view, this is a loaded question. I fully understand. Where do we begin to build a flourishing society?
Well, we have to deal in many, many countries with, some would say it's the lowest lying fruit, but I think it's the biggest problem affecting the most people. Economic inequality and racial injustice. And by economic inequality, I mean the things like the Gini coefficient, the levels and disparities between the richest and the wealthiest, and the amount of wealth held by the richest and the paltry amount. Economic inequality is affecting everyone, even the wealthiest people. There's plenty of evidence of showing this now. It's just that even in the most economically unequal societies, yes, the wealthy live longer and healthier lives. But when you compare them, the wealthiest, in the most unequal societies like the US, to just a country like the United Kingdom, which has lower economic inequality, our wealthiest are doing worse than are doing no better than the poorest in the United Kingdom. So that shows you how far-reaching it is, but how much worse.
Yeah.
The people at the lowest 40% of income quintiles, their life expectancy has been declining in the United States.
Wow.
Life expectancy has been declining, and amongst the lowest two quintiles, and the gains of life expectancy have been paltry and small, even at the higher levels, because we're such an unequal society. And then later on that, racial injustice. I mean, we're going to address this because we have to address this.
Yeah.
Those two things, a society cannot function with those two things at its worst. And we are the epitome of it right now. And if political leaders and business leaders are waking up to that, the bottom line hurts when the vast majority of our population, upwards of 80%, can't even afford to buy basic necessities. What's the point of producing and manufacturing all these products that are unattainable or put people in debt? So we have a long way to go, but we would make great strides into that. And then don't get me started on education inequality. There's no excuse. No excuse.
Yeah.
That's another
No.
podcast.
And it
Yes.
sounds sort of like you're saying, how do we even begin to address mental health and mental illness when our society needs such a large-scale restructuring?
Yes, Congress is arguing back and forth about infrastructure. You know what the infrastructure of a great nation is? How
What
well
is
its people trust each other, think that life is fair, and are willing to work and cooperate. The greatest infrastructure is the people. And this government, I don't care, Democrat or Republican, our physical infrastructure is woeful right now. But our human infrastructure, because our political leadership just tolerates this stuff, is even worse. So we need infrastructure, but we need an infrastructure bill that addresses and brings more people along into the education and the opportunities. And don't get me started in higher education. Here I am, a professor at a wonderful university that costs way too much. I'm sorry, but it is. It's ludicrous that our students are coming out with such debt just to get through undergraduate.
Yeah.
So education, income inequality, racial justice. Boy, we could go a long way.
When we're talking about flourishing and we're talking about this two-continuum model, people, like I was alluding to earlier, they want to know what they can do. They want to know what they can do today, for example, to build, their resilience or enhancing their positive mental health. How can people go about doing that?
Yeah. There's one study that I'll often use in this regard. I ended up reviewing it as an outside reviewer for publication, and it's called A Tuesday in the Life of Flourishers. And at the time, this was a graduate student who became a professor, but she published this study. And I was drawn to it because it was a short-term but longitudinal. And second, it focused on 6 practical activities that we could all be doing on a weekly, if not daily basis. So every Tuesday, she would call up her participants and ask them if they did any of these 6 things. And now I'm going to test my memory again. 1, did you exercise and how much? Exercise. Second, did you socialize or connect with another person and people, your friends or family? Third, did you help somebody? In other words, engage in some pro-social behavior. Fourth, did you learn something new? Fifth, did you play? And how much? And last,
Always neat.
wait a minute, it's on the tip of my tongue. I knew I was going to miss one of them.
Don't worry, the listeners are going to have to go read the paper now.
Yes. Okay. Forgive me.
That was all your spiel to get them to actually go and read it by pretending that you actually don't remember.
Yes.
It's a test.
See, here I'm going to experience what they call the Zygarnik effect. I didn't complete it. This is going to bother me even after we...
All day, yeah.
But here was the thing. Now, if you did more of those 5 out of the 6, the only one thing that didn't produce a better day. Now, right, she measured how good they felt at the end of that day and correlated the amount, whether they did the activity and what amount. If you exercised and exercised more, you didn't end up with any better day than those who didn't exercise or exercised very little. But you did more of the 5 things. You played, learned something new, socialized. And the other thing was engaged in a spiritual activity. That was the last one, right? So if you did more of those 5 things, you had a much better day. And then what she did was break them out into 3 groups. One that met the criteria for depression, and then one group that wasn't depressed but was flourishing, and the other group that wasn't depressed, wasn't flourishing. Now, if it didn't matter if you were one of those 3, if you did very little of those 5 things, you didn't have a very good day. The good news was if you were depressed or if you were not flourishing, if you did more of those 5 things, you had a better day. But not flourishing and depressed were indistinguishable. All right, you couldn't tell the difference. But at least if you did more of those 5 things, they had a better day. But if you were flourishing and you did more of the same 5 things, you had a way better day than if you were not flourishing and did all those things, or if you were depressed. But then she was following them longitudinally, and here's what she found. I called it the virtuous circle. So imagine you're flourishing. That's where we want everyone, because if you do those 5 things, you have a really good day. If you kept at it and did more of those 5 things, not only did you feel better, but 2 facets of your mindfulness increased over time. You became much more observant of the world around you, and you became less emotionally reactive to things, especially when they were bad. And as you became more observant and less emotionally reactive, your positive mental health increased. And therefore, you did more of those 5 things that led to more observance and less reactivity. And so the kick is this. Those 5 things, spiritual activity, socializing, helping somebody, learning something new, etc., are things that we can all do and appear to have a very promotive effect on us. So in addition to trying to get your vitamins in the morning and eat your 3 meals, you should play a little more, learn something new, help somebody else, etc. And preferably on a daily basis.
Well, Dr. Keys, you've walked us through the Two-Continua model, and you've shared some takeaways that we can do as an individual and at the level of society. So as we wrap up, what would you like our listeners, as let's say one takeaway they can gain from this conversation, what would you like them to know about positive psychology and mental health?
Human beings are wired to have what we call a negative bias. And by that, the negative bias is that when anything bad happens, or we hear anything, or we see anything bad, it's processed more deeply than the equivalent good thing. And it's processed that way because we're wired to do one thing at the beginning and immediately is to survive for another day, right? But that negativity bias needs to be overcome, because for every one bad thing that draws your attention to it over the equal one positive thing, in reality it takes 3 or more positive things for every one negative thing. And so Epicurus said this: we need constant reminders in order to be focused and stay focused on pursuing happiness and a pleasant life. Why? Because evidence shows we need to be reminded daily to put a lot more work and attention on the positive. Otherwise, what's the point of living and surviving one more day if you're not going to add quality to the quantity? And that's something I always say. So the negativity bias is there to give you one more day. That's quantity. But what's the point of adding another day of life if you're not going to prioritize the positive? It sounds great, but it's going to take work. It takes work and focus.
Awesome. Thank you, Dr. Keys. This was a fantastic, enlightening conversation. This is sort of a discourse that is not popular, and I know you referenced it yourself. You've been talking about this for a while, and then we didn't even really get into, you did touch on a little bit about how COVID-19 might influence where we go in terms of the landscape of mental illness and mental health. But this is something that we should definitely reshape our thinking about, how we think about this, and in turn, how we address the problem. So thanks for sharing your knowledge and expertise. We definitely appreciate that.
Yes, thank you. I definitely enjoyed this conversation, and I hope you enjoyed your time on the podcast.
I did. I appreciate it, and thank you for having me.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.